Autism Disorder by Audrey Yoder. I chose this topic because I'm going into the nursing profession and I thought it would be very interesting to do one of the main disorders that children within the United States have. It'll really help me within the medical field being more knowledgeable about this topic. Introduction. This presentation is about autistic disorder and we'll go through what is autistic disorder, what causes it, how it's diagnosed, the symptoms of it, what does it affect within the children, are there any treatments for it, and how do children obtain autism? What is autistic disorder? It is the most extreme form of autistic spectrum disorder, also known as ASD. It is a complex developmental disability that develops in children between birth and 3 years of age. What causes autism? This is a question that many scientists ask. They're not really sure what causes children to get the disorder. They've done many studies and found some things that reoccur, but not enough to prove it is what causes it. The genetic factors may include either genetic mutations or of hundreds of genes related to increased risk. About 15% of cases of autism can be attributed directly to genetic factors. Research is beginning to point to the factors that cause autism. These include a complicated tapestry of environmental and genetic factors that interact in ways we don't yet understand. Genetic factors interact with environmental factors, including age of both parents and prenatal health of the parent and the child. Unknown. There are still many factors that are still not well understood. Researchers are looking at the role of the immune system. They're also looking at the different genes within every children to see if there's any DNA or anything that causes the children to get the disease from maybe their parents or anyone within the family. How is it diagnosed? By age 2, if the child is not trying to talk, they do not respond to their own name, they have very poor eye contact, they have excessive lining up for toys or objects, they don't smile, and they have no social responsiveness. They don't really want to do anything with anyone. This is normally how scientists can tell, or even doctors, that the children has autism before the age of 2. After their toddler years, if they still have the inability to make friends, they will not start or continue a conversation with others. They have to stay on a specific routine. They really don't want to go away from their routine that they have every day. They have preoccupation with objects or subjects. They have patterns of interest large in intensity and no imagination, and they do not role play. Normally, they don't really want to do anything with any other person. They don't want to do anything out of their natural routine. They also get focused on one subject, maybe like airplanes, and they get really focused on learning everything about airplanes and how they fly and why they fly and what causes them to do this, and they get preoccupied with this one subject. What are the symptoms? There are quite a few symptoms that children with autism may have. Children can have few or almost all of them. They are easily categorized into 3 subsections. The first being social interactions and relationships. The second would be verbal and nonverbal communications. And the third would be limited interests. The first one, social interactions and relationships. Normally, they cannot establish relationships with other children. They will stay very private. They don't want to share their interests with others, such as the airplanes. They would not want to tell anybody else about their airplanes and how they work and how everything develops within them. They also don't have empathy for others and don't understand other people's feelings. The second, nonverbal and verbal communication. 40% of children with autism never speak. Difficulty starting and continue conversations. They repeat words or phrases over and over. They have a hard time with things such as eye-to-eye contact, face expressions, and body posture. limited interest. They will focus on a small part of something rather than the item as a whole. They get completely absorbed into one topic and will learn everything about the one subject. Routines consume most of their day. They have certain behaviors or motions known only to them. What does autism affect? Most people believe autism only affects the brain, but this is not so. Autism also affects the gut and immune system. With a new study, scientists think that autism may one day be treatable. Are there any treatments? With autism, it mainly affects how they communicate and live their daily lives. People take their children to specialists that help them develop normal verbal characteristics. Specialists can help improve the way children with autism communicate with others. A lot of people, when they get older, you can't really tell that they have autism as much as you could when they were a child, and this is because of the different doctors that their parents or specialists or everyone that can help with their developmental, trying to make sure that they are trying to communicate with others and the different aspects of their lives. How do children get autism? Scientists are not exactly sure how children get the disease. They think it may be generated by genes. Some people believe they inherit the disease. Others believe it has to do with chemicals such as lead, mercury, exhaust fumes, and many, many more. These are all my references.